Thank you guys for joining today. We're going to be speaking about eligibility for FQHCs and RHCs regarding the Quality Payment Program. First off, I need to let everyone know that the information contained in this presentation is for general information purposes only and does not attempt to provide medical, mental health, or any other type of healthcare service. This presentation is not intended to be an alternative to medical treatment, and the content of this webinar may not apply directly to specific circumstances. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied about the completeness, accuracy, reliability, or suitability with respect to content. So now to take care of a couple of housekeeping items. Today's presentation will be recorded, and that recording will be sent out within the next few days to our clients and attendees. All lines are muted during the presentation. We unfortunately won't have time to have a Q&A today, but we will display contact information at the end of the webinar for anyone who would like to email a question, and we will reply back via email. That email will also be listed in the Q&A box if you would like to jot that down. All right, so this slide covers the services that we currently offer here at the REC. As you can see, we offer a variety of service lines to meet your inpatient and outpatient needs, and we continue to expand on these services as we see a need. Please reach out if you have any questions or see something that is applicable to your organization. We are always happy to assist, and we're here to be your trusted advisor. So your presenters today, my name is Tabitha Hanlon, and I'm a Quality Improvement Advisor with Kentucky REC. I'm joined today by my fellow advisors, Robin Colonel and Jessica Elliott. So during our webinar today, we're going to be doing a brief MIPS overview to give you some background on the Quality Payment Program. Then we're going to move into impacts for FQHCs and RHCs with regard to the final rule. We're going to discuss how to determine eligibility for the QPP. And then finally, we're going to talk about action plans and next steps if you find that you're an eligible group or have eligible clinicians. All right, so let's move right into MIPS overview for 2023. All right, so the Quality Payment Program was founded out of MACRA legislation, and it provides multiple tracks for eligible clinicians. There are two main tracks, and those are MIPS and the APM performance pathway. So historically, healthcare has been a fee-for-service industry, and CMS wanted to transition that to a value-based industry where reimbursement for services is more based on a clinician's effectiveness at preventing illness and promoting health. So the Quality Payment Program has created a path for participants to transition from that fee-for-service industry into a more value-based care model. So we're going to begin at the bottom of our little stair steps here with traditional MIPS. And MIPS stands for Merit-Based Incentive Payment System. And that's going to be your foundational layer of the Quality Payment Program. And it's going to focus more on pay-per-performance than payment for services. Our next step up is MVPs, or MIPS Value Pathways. And this is still a part of MIPS, but it's kind of where the program's evolving to. This reporting option is going to offer a subset of measures and activities relevant to a specific specialty or a specific medical condition, and it's a new reporting option for 2023. So following MVPs, we move up another step to the APM performance pathway, and that's going to include your APMs and advanced APMs. With these models, CMS is pushing quality healthcare, but they're also placing a really high emphasis on controlling cost. And as you progress through this pathway from APMs to advanced APMs, you're going to progressively take on more risk. But there's also going to be a potential for high reward as well if you do well within the program. So with all of these models of care, CMS is moving toward that value-based care model. There's a definition of value, and it's at the bottom of the slide here in a little graphic. And basically saying that the quality of care, or the sum of quality of care that is being provided with additional outcomes that patients have, divided by the overall cost of care for those specific services to be able to achieve those high quality outcomes. All right, so now we're going to move into thresholds and category weights. So on the left side of your screen, you're going to see a pie chart. And this is basically just covering traditional MIPS. So for these category weights, these stayed the same from the prior performance period. For quality and cost, you're going to be weighted at 30% for both of those categories. Promoting interoperability is at 25%, and improvement activities is at 15%. So with category weights, they do differ from one reporting method to the next. So your quality weight is going to be different from traditional MIPS versus APMs. But one thing that does stay consistent overall is the thresholds. So if we look on the right side of our slide in the pyramid, you'll see that the current thresholds are listed there. CMS decided to maintain the previous threshold of 75 points for the 2023 performance period. So if you receive anything below that 75 points when reporting for MIPS, you could potentially have a negative payment adjustment or a reduction in your Medicare Part B reimbursement, So those levels in the red and gray would be that reduction or negative payment adjustment. So for those at the very bottom in red, from 0 to 18.75 points, those would get that full 9% negative payment adjustment. Up in the gray area at 18.76 to 74.99, those could get up to a 9% negative payment adjustment. So depending on where you fell within that range would depend on what your payment adjustment would be. Then we're going to move up one more level to the current threshold at 75 points in the green category. That's going to be neutral. You're not going to have any negative or positive payment adjustment. And then up in the blue category, having 76 to 100 points, those would get the positive payment adjustment. And that sounds great, but then you have to remember that this program is a budget neutral program, meaning that those that have a negative payment adjustment are going to fund those that receive the positive payment adjustment, or those that the losers fund the winners, I guess you could say. So if you're eligible and you decide not to submit, or if you don't know to check or how to check your eligibility and you don't submit, you could receive that full negative payment adjustment of 9%. And for those that rely heavily on Medicare Part B reimbursements, that could be devastating financially. So it's really important to know how to check your eligibility, and that if you have eligible clinicians or you're eligible as a group, that you make sure that you're submitting for MIPS. So now with that said, we're going to transition a bit, and Jessica will speak more about MVPs and some of the final rule changes.
Thank you so much, Tabitha. And again, thank you all for joining us this afternoon. So I'm going to talk with you. We're just going to talk just a little bit about MVPs. Tabitha mentioned that that is a subset of MIPS, and it's going to be the next evolution. So traditional MIPS, we anticipate that to be sunsetting here over the next few years. CMS has not given the official date for when we will be exclusively utilizing MVPs to fulfill that that aspect of the quality payment program requirement. But ultimately, at the end of the day, CMS is forecasting that you're either going to be participating in the quality payment program through MVP submission, or you're going to be part of that APP track, which is that alternative payment model performance pathway. So you're going to be in some type of an APM, whether that's a MIPS APM or that's an advanced alternative payment model. But so for the intents and purposes of today, I just wanted to just do a high level talk about what are MVPs. And you can see in that little pyramid on the slide there that those are similar, those are the same categories that we have with traditional MIPS: cost, improvement activities, quality measures, and then also promoting interoperability. And so those requirements are going to stay with us as this program evolves. Those are also the same and very similar. Those are the same category requirements for our alternative payment models as well. While they don't necessarily have the cost category, cost is contractually baked into those payment arrangements that they have. Now, so MVPs are really going to serve as that bridge. CMS has noticed that there's not been a strong uptick in adoption to alternative payment models, or at least as strong as they had initially hoped. And so they feel that MVPs are going to be that structure that helps practices bridge over to adoption of participating in an ACO, participating in some type of an alternative payment model through CMS. And so these MVPs, or these MIPS value pathways, are focused around a particular subset of patients. They're going to be a population of patients within your care. They are going to be focused on an event, an episode of care that you deliver. And again, this is something that is supposed to start to align us with looking through a very focused lens and aligning the quality measures that we report along with our improvement activities and any of those cost measures that are associated with that type of care that you're delivering. And so some of the different focus areas are going to be around, and these are the currently developed MIPS MVP pathways. There's 12 of them total, but they cover several different subject areas listed out. So we're going to have some primary care-based ones, and then we also have some specialty that include cancer, kidney care, anesthesia, emergency medicine, and neurological, stroke, cardiac, rheumatology, and some orthopedic ones as well. CMS is anticipating to add additional MVPs in future performance years to expand those capabilities. So again, this is something that we are moving to, and it's really to create a more streamlined, focused approach to submitting for the MIPS program, and ultimately that bridge over into APMs, where you're looking at your quality, your cost, and balancing all of that with your outcomes. The next thing I want to talk about is some of the information that gets covered in the final rule of the physician fee schedule, as well as the quality payment program final rule. It's combined into one rule that they release out in December. And there's definitely information in there that is applicable to FQHCs and RHCs. And so we just wanted to take a couple moments to talk about some of those different components and elements that are applicable to your scope of practice, regardless of whether you're eligible for the quality payment program or not. CMS has made some flexibility with the compliance date for the electronic prescription of controlled substances. They are limiting the compliance actions through December 31st of 24. So what they'll do is, if you're not compliant with e-prescribing to this point yet, they will issue a non-compliant letter to prescribers that might be violating that electronic prescription requirement. They have also, for 2023, they have expanded what is being considered as an electronically prescribed controlled substance. They've moved it and expanded it to Schedule 2 through 4 for controlled substances that are part of the Part D prescription drug benefit. Also, to let you all know too, that they did finalize multiple exceptions for the prescription for around this e-prescribing controlled substances mandate. And so there are a couple different aspects of it that you're going to be able to potentially utilize. Is that they're going to take your prescription drug events data from the current evaluated year, and they're going to determine whether that prescriber qualifies for an exception. So CMS is going to make that determination based on the number of Part D controlled substance prescriptions that are prescribed by that individual prescriber and dispensing pharmacy. You will be able to take advantage of an exception if you issue less than 100 or fewer controlled substance prescriptions for Part D per calendar year. And again, CMS is going to make that determination using claims data. And also, they have added some additional exceptions around location of providers. If you are a part of an emergency disaster, you would be able to apply or participate in an exception to this particular aspect of the program, and they'll identify that based on your address in PECOS, and also looking at your address in PES as well. And prescribers who have received a CMS approved waiver because the prescriber is unable to control to conduct electronically prescribed controlled substances, perhaps due to circumstances beyond the prescriber's control. So there is an opportunity for a waiver as well. Additionally, some other information that CMS has included in the final rule related to some additional billing codes that we wanted to call out. So there's some expanded potential to be able to capture that non-face-to-face time that's required around coordination of care, specifically around chronic pain management and treatment, as well as care management for behavioral health conditions. So there are these two new HCPCS codes that are available. These codes are going to be payable alone or with other payable services on an RHC or an FQHC claim starting on January 1st of 23. So this is available for this current year. And these particular codes are separately payable from the RHC all-inclusive rate and the FQHC physician fee schedule, or excuse me, the PPS traditional payments. So that's just another aspect that we wanted to just highlight for you all today. And then finally, this applies as well to RHCs and FQHCs. Colorectal cancer screening updates. This is fantastic. Finally, CMS has caught up to the evidence-based best practice of reducing colorectal cancer screening rates from the age of 50 down to 45 years. And so from 45 years and above, they will begin to provide coverage for those. They have also expanded the regulatory definition of colorectal cancer screening tests. And that's also going to include that follow-on screening colonoscopy after the positive non-invasive stool-based screening. So that is fantastic that they've expanded that definition as well. And then they're going to pass on some savings onto beneficiaries as well. It's going to be transitional and gradual over the next few years. And first we'll see, a 15% for those beneficiaries all the way down into calendar year 2030, where there will not be, there'll be a zero patient responsibility for those services moving forward after 2030. Now, with that, I would like to hand the presentation over to Robin Kernel, who will talk with us a little bit about eligibility and determining if QPP is something that's going to be required for you in your practice.
Thanks, Jessica and Tabitha, and welcome everyone. Thank you for joining us. So we'll get just right into this. That's the whole reason we're all here. So CMS is very specific regarding eligibility, and so we would never want to assume that all of your providers are exempt. And so I want you to think about those folks who still make rounds at hospitals, especially in our rural areas. Think about diagnostic services, anything paid outside your FQHC or RHC inclusive rate. CMS actually was very specific about how they could be eligible for this program. So I'm reading it right from their resource that they have called for small and underserved rural practices. So if you bill exclusively through your RHC or FQHC payment methods, then you're not eligible for payment adjustments under MIPS. However, if you are part of an FQHC or RHC and bill for Medicare Part B services under the physician fee schedule, then the payment for those services could be eligible for MIPS adjustments. So it's strictly around your billing. And so you want to keep that in mind. And we never want to assume each year that well, we weren't eligible last year, so we probably won't be eligible this year. You can just, CMS makes changes frequently, so you don't want to ever assume that. So when we talk about eligibility, so to be eligible for these payment adjustments, whether negative or positive, first you have to be an eligible clinician type. We've listed those there in the gray bar, so I won't go through all of those. But you'll notice that most of it are provider-based individuals like physicians, NPs, PAs. But you'll also see other clinicians, specifically around rehab or registered dietitian or nutrition professionals. And so you think about, are they eligible for the program? Consider if those other professionals bill directly for their services. If they bill under their own NPI with your group tax ID number, they could be eligible for the MIPS program and be subject to these payment adjustments. So just keep that in mind. Most of the time, your rehab folks and nutrition staff, they all bill under the group provider number for that hospital, but just keep in mind that they could be if they're on their own practice. So eligible clinician type, you have to exceed that low volume threshold. It's listed here below. It's all around billing Medicare patients and professional covered services. So if you're billing at least $90,000 in Part B allowed charges, have at least 200 Medicare patients, and then 200 professional covered services, then that means you're above the low volume threshold and you're eligible for the program. If CMS deems that you are not a qualifying participant in an APM and you've been enrolled in Medicare prior to 2022, or going forward if they've been enrolled in Medicare for at least a year, they are all considered an eligible clinician at that point. So CMS looks at eligibility a couple of times in the year. So it all runs October to September, and it's generally a 2-year period. So right now what you're seeing, if you were to go and look at eligibility, it's what was posted last year in December. And going forward, it'll be the same way. CMS updates eligibility generally 2 times a year. We'll see it in the spring and in the late winter. And this is all arrived from claims data. CMS looks at this claims data for not only your volume, but they also use this along with zip codes and location codes and place of service codes to assign special statuses. And this is also when they update clinician lists for practices as it's pulled from PAYCOs. So when you go in and add a provider into PAYCOs, it's not a live feed over to the QPP portal. So that brings up the second thing. When you check for eligibility, you want to review your clinician list that QPP is using to ensure that it includes all of the folks that's within your, underneath your tax ID. I mentioned special statuses a little bit earlier. So these can apply at the provider and or the group level. And they do allow for flexibilities within the program for providers and groups. You'll see on the screen that there are some that are around place of service code. So non-patient facing is if they have fewer than Part B facing encounters, but also place of service codes affected hospital base or ambulatory surgical center. The HPSA in the rural areas come from zip codes and how the Public Service Act is written, and then the small designation is those that have 15 or few clinicians billing underneath the practice tax ID. So if you have multiple tax IDs within your organization, you could have one tax ID that's labeled as small and one that's not. This special status, it allows for some flexibility within the program. So some of these folks that are deemed non-patient facing would in fact have a couple have a category reweighted for them. Same thing would happen if you're deemed as a small. So it's important that this information is up to date in your PAYCOs and that you're billing the appropriate place of service codes associated with those claims as well. So how do we check our participation status? So there's a couple of ways. We go to our favorite website, qpp.cms.gov. If you're on the home page there, you have this option to check your participation status here. In this place, you would simply enter in the NPI number for your provider or your clinician and click check status. It'll actually give you the most current year eligibility status, but you also have access to prior years so you can see if there's any changes. You can also, on this same eligibility check, view how many practices that provider's associated with, and it will give you their eligibility for each practice at both the provider, which is the individual level, or under the group, which is the tax ID. This lookup will tell you if they meet the 3 parts of the low volume threshold, but it will not give you the actual volume or the actual number of covered services by this clinician or professional or covered beneficiaries professional services, Part B volume. Oh, I jumped ahead. So this is what the rest of that looks like when you pull up that provider eligibility. It gives you clinician level information and it gives you practice level information. It is possible that when you look at the other reporting factors here, that clinician level and practice level could be different, as here in this example. We can see that at the clinician level, the provider does in fact exceed all 3 of the different eligibility factors there. They are considered an eligible clinician type and they were enrolled in Medicare prior to January 2021. So you can tell we grabbed some screenshots a little early. Then on the other reporting factors, which is the picture to the right, we see clinician level and we see practice level. These are those special status codes that I mentioned a couple slides back. In this particular case, this provider is considered non-patient facing and is part of a small practice, but you can see at the practice level that we only have the small practice designation. And that's simply because maybe this particular provider works in one of those other special statuses that we mentioned that's not patient facing, that's not doing enough of their services under Part B. But maybe the practice as a whole does not meet that requirement. It does not meet that non-patient facing status. And then below we see practice level information. So I mentioned earlier that you also do not get the actual dollar amount for Part B charges or the actual number of covered services under this view. If, however, you log into the actual QPP portal, which if you go to that same website in the top right-hand corner, it'll say QPP portal sign in. You will need a Hearth account at this point to do this with specific user roles that allows you to view data on this portal, and there's different levels of user roles, and some can do some things and obviously some can do others. This is a private portal specific to the organization, and as you can see, it gives you a timeline here at the top that tells you exactly when things are due. These dates actually generally don't waver, just so that you know that going forward if you've never visited this portal. You can see on the left blue banner, it gives you a menu of options there. Specifically today, we're talking about eligibility and reporting. And then we can see that also on this screen, the option to start reporting if we wanted to. Our next screen though, under eligibility and reporting, it's going to list all of the practices that you under your HARP account have access to. So if you have multiple tax IDs within your organization, you need to make sure that you've requested access to that if that's appropriate for what you'll be doing. And when you see here on our screen, we actually have 2 practices here. And we see that practice 1 is MIPS eligible. It's listed there in a green bar. It actually gives us our total volume as far as Medicare patients seen here, the allowed charges in this practice, and the covered services. And then below that you see specifics, and it's a little hard to see here, but since we'll be sending out a copy of the recording later so that you all have access to this, then it says special statuses, exceptions, and other reporting factors. And in this case, this practice is considered hospital-based and non-patient facing. And then you can see in the red circle here, we have view practice details and clinician eligibility. And it will be at that point that you would select that. It's actually a hyperlink. Select that and you can look at all of the providers listed underneath that practice. And then for each practice or for each provider, you would see the same data that applies to them. So whatever their specific low volume is. Practice 2 here is listed. They would in fact be MIPS eligible. Same options here, you would see all of the providers that are associated with Practice 2 listed here. The significant thing for me under this portal is that now if you have providers who aren't maybe MIPS eligible today or this year, you can at least get that data and know how close they are to being eligible. I mean, they may never see enough patients, but then you may have some that as their practice grows, their volume for any of these particular metrics is going to grow with them. So we encourage you to access through the portal, get your HARP account, and specifically look at eligibility for your clinicians, especially your high volume ones, and those that I mentioned earlier who are still making rounds in hospitals and any of your diagnostic tests. So at this point, I'm going to flip this back over to Jessica to round out our presentation for today. Thanks for joining us.
Thank you so much, Robin. And so I want us to take a few minutes and just talk about, now that we've gone over eligibility and just what that looks like and how you can look it up and access it. I wanted to just talk with you about some of the next steps. Where do you go from here to see if, you know, QPP applies to the amount of billing that you do at a tax ID level or at that individual clinician level? So we've come up with a little bit of a decision tree here to kind of get us started. And so when you're first diving into it, whether you're going through the QPP portal itself or you're just using the QPP lookup tool, it's important to start out at that first initial level of where are you tied, because remember there's two primary tracks in the QPP in which you can participate right now, through that traditional MIPS MVP side of things or through the APM track, which is that APM performance pathway. So if you're part of an advanced alternative payment model or you're a part of an ACO that's a MIPS deemed APM, you would need to be able to look at that because you're going to have different reporting requirements under the umbrella of QPP. So at that first level, you want to ask yourself, is your tax ID or your individual MPIs tied to an accountable care organization? So if that is yes, and they are, you would want to reach out to that individual ACO to see if what are your reporting requirements. If they're a MIPS deemed, or excuse me, a CMS deemed MIPS APM, then they are going to be reporting through the QPP through that APM or through that APM performance pathway. If you're tied to an advanced alternative payment model, there are still going to be reporting requirements, and depending on the thresholds that you meet and that you're tied to based on your beneficiaries and the Part B charges that are processed through that APM, you're going to have different reporting requirements. So again, reach out to that APM or that ACO if you find that your providers are tied to one. Now, if you are not tied to an ACO, the next level are, do you meet any of those low volume thresholds? And those low volume thresholds that both Robin and Tabitha talked with you about today, remember that's the $90,000 in Part B billing. That's really important to pay attention to. Also, you want to look at the number of beneficiaries that are attributed to you either as an individual clinician or as a group. And that magic number is 200. That you have to have in order to be required to report. And then finally, you have to have at least 200 covered professional services billed during that look back period as well. So you have to meet all three of those criteria. So our question is asking, do you meet any of them? Well, if you don't meet any of them, then when you follow that to the no, you are not required to report for the current performance year, right? So if you don't meet any of the three, you don't have to worry about it. You don't have to pass go and collect $200. You are good to go. Next is, if you meet even one or two of those low volume thresholds. So maybe you meet maybe you meet the 200 covered professional services and you meet the 200 beneficiaries, but you're not quite to that $90,000 in Part B. You are considered opt-in eligible for the program, meaning you are not required to report, but you may report. And if you do report, you could, depending on your overall performance around those categories, you could receive a positive payment adjustment. And so that's one of those where we like to work with our practices who are opt-in eligible. We guide them to help select measures and to prepare to attest and to report. And if it's financially advantageous for them to report, we do help support them in making those decisions to fulfill the requirements for the QPP program. Now, if you meet all three of the low volume threshold, you've got the $90,000, the 200 beneficiaries, and the 200 covered professional services. While we say it's eligible for the program, it means that you are required to report. CMS phrases it a little bit more nicely than saying that they're required, but if you're deemed an eligible clinician, that means you are required to participate in the quality payment program, and you can start out in that MIPS track. And so that's really that decision point that it's important for you to take a look at. We work with our clients to help do those eligibility checks, to help you connect to the patient portal and to navigate what all that information means as well. Now, a couple other things that if you do find yourself in that situation where you're opt-in eligible and that you do have the potential to earn a positive payment adjustment, and that you want to consider that, there's some things that you need to take a look at. You want to look at, your reporting capabilities. Do you submit at a group or an individual level? What is going to be the most advantageous? And then also, what are some of the technological limitations or capabilities of your organization to be able to report at those different levels? You also would need to identify the way in which that you would participate in the program. So whenever you're submitting for quality, you have to identify the type of measures that you're going to submit. And so measures can be submitted via ECQM or electronic clinical quality measures. So those are your measures that are within your EHR reports. MIPS CQMs, those are registries. So if you're a part of a registry or a QCDR, then you could utilize MIPS CQMs as a mechanism for reporting or a collection type for reporting your data. If you're a small practice and you're choosing to report or required to report, and by small practice meaning that you have 15 or fewer eligible clinicians tied to a tax ID, you're an individual clinician that's attesting, you can submit via Part B claims billing. And so those are the codes that are associated with the claims related to the care that you're billing CMS throughout the year. And then that final level is looking at the different clinical quality measures that align with your patient population and the scope of care you provide. So ultimately, at the end of the day, it's important to look at, what are your vendor capabilities? What is your current data reporting capabilities if you do choose to report for the program or you are required to report for the program? You want to be able to assess that. We also want to look at any of the special statuses that Robin talked about that give you some additional flexibility within the program. The flexibility could mean special reweighting the promoting interoperability category, or it could be some special flexibilities around the amount of improvement activities that you have to do. There can be several different opportunities that can be beneficial to your scoring if you qualify for those. And then also finally, understanding promoting interoperability as this program has gotten more challenging, and the thresholds at 75 points out of 100 that you have to hit to avoid penalty. Utilizing promoting interoperability is a very important aspect of the program. And so here at the REC, we work with you and we partner with KHI at the state to be able to help provide and work through how to meet those promoting interoperability requirements for success in that program. So with that being said, there's a lot of different things to consider, and we are here at the REC to help support you. We can help work with you, on identifying what are your aims, what are your priorities. We can help you, with the basics of navigating this program and understanding where your reporting obligations lie. But ultimately, at the end of the day, we want to help you, optimize your system, optimize your performance, so that you're successfully performing in this program to get the highest positive incentive that you can earn, and also that we help you align it with other programs, right? We know that there are so many different quality reporting programs out there, and to help you to try to develop a strategic approach to your quality improvement that you're doing. Because not only is this important for those private payers out there and these other incentive programs and those dollars and that revenue coming into your practice, but also it's about improving the outcomes for our patients here in the state too. So, improving and expanding colorectal cancer screening rates, like where we're seeing some of the flexibility coming forward now to expand that program here in the state. We want to be able to work with you on those quality improvement initiatives to help strategically drive that change that you want to make within your organization. And so whenever you do partner with us, just know that we do offer a whole host of resources as a part of that work with us. You have your own dedicated advisor for that at the elbow support. We help guide you through gap analysis, looking at what your goals are and helping you monitor your quality performance as well as your overall QPP performance. We walk you through some of the legislative updates from the Quality Payment Program and beyond to help you navigate some of those challenges and to help interpret some of that information for you so that you can make those informed strategic decisions year after year, and that you can set yourself up for success as we are moving further and further and deeper into that value-based payment world. And so how do you not only survive, but how do you thrive? And really focusing with you on that aspect as well. So lots of different services. I won't go into every single one of them, but again, a copy of the recording will be sent out to everybody so that you can take some time to look at that. One of the other benefits that we have is we provide a lot of education to our clients so that you can make and your leadership can make those informed strategic choices for your organization. And so when you sign with us, you have special client only access to some of our educational materials. We provide one-pager fact sheets that are kind of small bites of information that give you some detailed information around facts and knowledge around certain categories. We also provide webinars related to the program as well, and on webinars around how to maximize your performance and to really implement quality improvement initiatives within your organization so that you'll be successful. So we do have a couple different webinars coming up. Our first one is focusing on the quality and cost performance categories across all the different tracks. And then in May, we're going to have one that's focused on promoting interoperability and improvement activities across all of the tracks. But each month it's going to be a different subject, and you do get full access to all of our educational content when you do work with us. And now I do want to just reiterate that we are not doing a Q&A today, but if you do have any specific questions for us because of this webinar, if you want assistance with checking your eligibility, navigating the QPP portal, anything like that, please don't ever hesitate to reach out and contact us. You can reach us at Kentucky KYREC at uky.edu, or you can give us a call at 859-323-3090. We are always more than happy to speak with you and to help you and see how we can help best work together and partner together to help improve outcomes across the state. I want to thank my colleagues, Tabitha Hanlon and Robin Kernel, for the presentation today. And again, I hope you all have a wonderful day. Thank you so much.